is Dr. Juarez, Paul Juarez from Meharry Medical College, and we're talking about what we earlier described as youth violence and intentional homicides or intentional injuries. And I think we've more than anything brought that topic from simply youth violence to talk about societal violence in a real sense, Doctor. And so let's continue our discussion here, Doctor.
Well, one of the things that I've learned to really appreciate is that dealing with violence, youth violence in particular, from again, a healthcare perspective, we use the public health model and a public health approach, and it provides a way for, and that's why it's called intentional injuries rather than just violence, is that we can understand that the outcome often results in an injury, and that injury was intentionally inflicted, and then using the public health approach, we try to break it down to look at what were the causes of this. Now, some of those causes may be personal, behavioral aspects. Somebody was, again, it could have been, again, got into a fight, they were angry, or there was a bad, it was a crime or something involved. But we need to look at the event, and you have a victim and a perpetrator. But you can look at the individual characteristics of what is it about those individuals that led to this event. But you can also then, so it's called the agent-host environment model. And so the host is the individual, either the victim or the perpetrator. The agent is the mechanism of injury. How did the actual injury occur? Was it a knife? Was it a blunt instrument? Was it a gunshot wound? And then so you can isolate it and look at, is there something you could do to target that to prevent the injury from having occurred? And then the third component is the environment. And how do you look at environment? Either the physical environment, is it in a, an area that, has, there's no lighting and it's a dark area where people can congregate and you get drug selling, or just makes it more likely for crime to occur, somebody getting mugged, etc. Or is it a park? What is it about the physical environment? Is there something about the social environment as well? So it's this combination of breaking it down and looking at the different aspects of intentional injuries to see, is there some way we can prevent it from occurring? And so that's been my focus, is really looking at prevention. Very good. So one of the things that I've been fortunate, I've got a grant funded from the Centers for Disease Control and Prevention to really address this problem of youth violence and intentional injury. And one of the things that we've been able to do is establish, we have several research projects, and I've got collaborators both here from Tennessee State and Vanderbilt that are working with me on that. We have some things going on in the school, some things in the community as well. But one of the real things that I'm excited about is we also established a community coalition, and it's called the Nashville Community Coalition for Youth Safety. And we have really been able to engage the public sector. We've got the academic community. We've got a lot of community organizations and just individuals who are interested and wanted to be part of this involved. We have over 300 people now. And it's something that we've had some strategic planning, and we've had youth. We get youth involved in helping us to see their perspective. We think it's very important to have the youth voice in the mix. And so they've helped us guide our, in terms of approach. And so one of the things that's come out of the discussions that we've had is we have 3 work groups. One that focuses on youth safety, a second one that focuses on mentoring or caring adults, and a third one that focuses on job training and work opportunities. And so we're using those 3 areas to prevent youth violence. And they all have different, they're all important. Youth violence has multiple causes, and so we need to have multiple interventions. But getting the community involved is a really important part of this.
And so there is a societal kind of thing that we can do other than, and I think that this would be less expensive in terms of what we're trying to do by just taking this drug gang situation being the cause of everything and et cetera. Speak to that about how expensive it is
again,
to try
to incarcerate someone for a year. I think the cost is, I think it's $40,000 to $50,000 now, which is about the same as college tuition. So if we can prevent somebody from being incarcerated, for violence, and we could pay for their college education. Now, again, we have to get them to that point. So we have, that's why it's very important to work with the schools, to work with a lot of other community agencies, because young people a lot of times, like myself, aren't exposed to role models, people who are encouraging them to go on and continue their education, to make them believe that they can actually do something other than what they see others doing in their immediate environment. And so we're really, one of the, again, the goals that we have through this coalition is getting caring adults and linking them up with young people. And we've got some major initiatives now that we're working on to do that. We've got a lot of the community agencies that do that. In fact, Tennessee State is one of them through the service learning program. I've talked to Dr. Sue Fuller about seeing if there's ways that we can actually link up some of the freshmen, because hey, you have service learning responsibilities for all students that are here at Tennessee State, and see if we can link them up with young people as they start high school, and let them progress together. You know, you have a college freshman who's mentoring a high school freshman and letting them go through this process together and talk and communicate and see what that's about, see what college is about, so that they develop not just the hope, but they can see themselves actually doing it. And I think that's really an important piece, is that we have to provide the opportunities for young people to see that they can actually, you know, rise above, you know, the situations, that there are resources out there, and there's a lot of caring, good people out there that will help them. And so that's part of what we're trying to do here is, you know, through the, again, call it mentoring and providing supports for young people and their families, because it really is a family. You know, we have to affect the whole family to help youth, you know, really to develop some, you know, these sorts of aspirations.
You know, before we get off this, Doctor, let's have you to say something in reference to Meharry Medical College, especially dealing with the area that you're involved in, and how that area is able to support what Meharry is doing now.
All right. Well, again, I never saw myself in academic medicine. I mean, this is, you know, for me, it was just, it was an opportunity that came and it arose. In fact, after I graduated with my PhD, I said, I'm through with education or college. I didn't ever see myself being back in. But again, the opportunity really to do research in this area has been just very personal, rewarding, because it's not just an academic issue for me. It's something that I feel very passionate about, and has provided me with an opportunity to train medical students about intentional injuries, to train our residents in family medicine and get them involved. What have you found to be the level of knowledge in reference to that in terms of dealing with these young people? Well, again, I don't think medical students generally have any or very limited exposure, and usually the exposure is around child abuse, because there's some mandatory reporting responsibilities that they have as health professionals, and the same with intimate partner violence. There's been more attention given to that area in recent years. But in terms of youth violence, they often have no understanding of what the problems are or what their role is. And so part of my responsibility is to help them understand that when they see a young person, they need to ask questions to see if, again, if they're being bullied at school, to see if they're if they're threatened on the way to school and after school. Who do they hang out with? Are their friends in gangs or gang involved, or their siblings? Because if they are, it increases their risk for getting involved in activities that may lead to them being either a victim or a perpetrator of violence. And so it's very important for a medical student to be able to make that assessment, not that they're going to treat them in that sense, but they can help either through counseling and guidance, or through a referral to community programs. And that's part of what we do, is help them. We give them a directory. We work with the Oasis Center that's created a directory of youth services here in Nashville. It's called the 411. So we actually provide that to the students and our residents, so that they know that there are other agencies and people out there that they can refer youth to who may be in need.
Very good. And of course, Dr. Juarez, let me, over this last half minute that we have here, thank you for bringing us that excellent information by, and I'm sure that those individuals who had an opportunity to hear what you had to say this morning will have a new understanding and a broad understanding. I certainly have a broad understanding of this whole idea of intentional violence and how we might be able to effectively deal with it in a real sense outside of the fact of dealing only with gangs and with drugs and et cetera. And of course, we want to thank you for that. And let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.